Back with my buddy here. We're now 1 week out of surgery, and we had facelift, upper eyelids, and full face CO2 laser. And this was my patient that was in such a good mood and did so well 24 hours after. And she's having a really pretty smooth post-op course. So we're here today. Turn way over that way. You can see that the peeling skin is coming off, and really I could take that off with my fingernail. So that's just the dead laser skin that's coming off, and you can see how nice her skin is under that. It's just like baby skin. And let's get a close-up of her incision here. They're healing quite nicely. She has dissolvable stitches, and she's got some staples up there. And she's got a little bruising and a little puffiness down here. And her eyelid sutures are out, and you can see those scars, but they'll become invisible soon. So, and we have some bruising on the neck. So tell us, how's it going?
It's going very well. I am so happy that I received the preoperative education that I did, as well as the ongoing support. I've felt very comfortable contacting the doctor personally with, I haven't had any real issues, but any small, questions in my mind, reassurance. He's been very obliging in answering so promptly and in such a friendly and professional manner. The staff here has been wonderful. My instructions have been very clear and easy for me to follow. I have, of course, had discomfort. You're not going to have a procedure like this without it, but it's been handled only with Tylenol, and once enough time had passed to where doctor felt it was appropriate, I was able to use some ibuprofen. So I've found that kind of trading off with those two medications has really helped a lot with the discomfort. And I can see so much improvement, and I feel better every day.
And it's gonna be really nice. And she's just been a model patient, and she's really breezing through this. Now, not every patient has such a smooth recovery, but this is how we like it. And one reason, she's just got a great attitude and a great spirit, and she did her homework. She really paid close attention to all of our handouts, all of our online things. She looked at our pictures, she watched our videos, she read all of our forms. And this is where the rubber meets the road, and she's just been such a great patient. So what we'll do is we'll look in here next week, and we'll see her at 2 weeks. Thank you so much.
Thank you.
Hi, Dr. Joe Niamtu, LoveThatFace.com. We've been following my friend here for throughout her cosmetic surgery experience, and we talked to her 24 hours after her surgery, 1 week after her surgery. So today's a big day. It's 2 weeks, and that's when we take out the staples that are behind the ear. We only use dissolvable stitches, so we don't have to take those out. And so we did facelift, eyelids, lower lid laser. All right? Yep.
I think so, yeah.
Yeah, we're good.
The works.
So anyhow, we're at 2 weeks. So how's it going?
It's going really well. I've had very little pain. It's been able to be managed with the Tylenol and with ibuprofen, but now it's just maybe once a day, if that. I'm very glad that today I got the clips out, and I'll be able to sleep flat. I have been sleeping elevated. I've been following all the instructions, and I'm doing the skincare using the products that have been recommended to me to use on my skin. But so far, so good.
Very good. And actually, we did full face laser, and that's healing well. We've got some bruising here that you see, and just a little bit of black and blue. These incisions are still raw, and they'll be invisible in a couple weeks. So she's doing really well, and just a great patient, follows our instructions, and this is how it's supposed to go. So we'll look in a couple more weeks and follow the experience.